Cormac O'Donovan, Director of the Comprehensive Epilepsy Program in the Department of Neurology. My clinical specialties within neurology is in the field of epilepsy and sleep disorders. When I was in high school, I was interested in the area of psychology and then psychiatry. When in medical school, I realized that I was interested in neurology and in particular epilepsy based on a mentor that I had early in my career, and I've pursued that as a subspecialty to this day. My patient care philosophy for those with epilepsy is to offer comprehensive care. Patients with epilepsy are very debilitated by their seizures, but also because of the brain injury involved in causing the seizures, they can have other problems which are not as easily recognized by physicians and caregivers, but very important to the patients themselves. Many times this involves a family decision, as they have a lot to do with the care of a patient with seizures. I think this provides better outcomes overall when there's a more comprehensive approach and everybody is involved in all aspects of the disease are looked at. In working with patients, I feel like it can be of most value to be a resource for them to learn more about their condition and the options for treatments to them. I think they also feel reassured that when they are at a specialized epilepsy center, where they may not have been before, they will have access to all the newest treatments and tests available. Having a team approach with nurses, technologists and surgeons, I feel that this will provide comfort to the patients where before they might have felt less than adequately treated or nervous about their condition. From my experience of being a patient, I think it's important that the physician or healthcare provider cares about your condition, but also acknowledges that you'll be involved in the decision-making process, which is very important, and I think that patients would like that very much. Well, having come from a large Irish family, I've enjoyed being involved in children's activities as well as other activities which was available to me as a child, and that's one thing that's particularly attractive about in North Carolina, which I've been able to continue through my own children. Sometimes people remark you can be a full-time parent and a part-time physician, because with two wonderful teenage daughters, life can be busy and wonderful in all those fun things that they get into.